Hello, Professor Zambrana. I'm Mauricio, student of Kaiser. I'm here today to present the assignment for CPT, which is chest physiotherapy. The purpose for the CPT, is for patients who cannot clear up the mucus from the lungs and not able to cough it up. So the mucus is like in the wall, and they are like attached to the wall, and the CPT, which can be manually or can be with other equipments like the PEEP or electrical, they help loosen up the mucus from the wall, and so this way the patients they can cough it up. So the indications is for people um, who has accumulation of mucus, especially cystic fibrosis patients. They usually they have a problems, and they always need a CPT. So it's a lot of different kind of CPTs. It can be manually, or it can be with a machine, and also can be with some kind of gauge, like let's say this is a cappella, so it helps the patients to do um, the therapy. So the manual therapy, let's say this is my patient, this is an adult patient, okay, a female patient. So we do the assessment first, but before anything else, we have to make sure we check for the doctor's orders and see which lobe, if it's the posterior, if it's the anterior, if it's the upper lobes, if it's the basal lobes. We have to make sure, because if you don't know where you're gonna do it and how, you can damage the patient. You can make more damage to the patient. So first thing, before anything, we have to make sure we got the doctor's order, and then we come to the room, we knock the door, we present yourself, introduce yourself to the patient, explain what we're gonna do, and make sure the patient understand. And in case the patient have, and they will explain, it's not painful, but they can feel a little bit discomfort. And in case if they feel pain or discomfort, they have to let us know. And after I get the agreement with the patient, I go do my hand washing. I do my proper hand washing, and then I put my gloves on, and then I come to the patient, and I assess the patient first. I do the vitals. I listen to his lungs, and also I ask the patient to position in bed, and I ask the patient to take a deep breath, and I check the patient, and then I check the patient's heart. And after that, after my vital signs, I start doing my CPT, and it's a lot of positions. The patients, it depends the order of the doctor. So we have a lot of positions in bed. Also, we can do the CPT asking the patient to sit up in bed. So, and we have to see what kind of position. Sometimes we put the patient in this position, and then we have to put pillows under the legs. So this way, actually, CPT, the key words is gravity. So we work with gravity, because if you ask the patient to lay down flat, nothing's gonna happen. So the patient, the mucus has to move in this way, so the patient can cough and clean up the airways, because the airways is all accumulated with mucus. So that's the idea. Work on the patient and make sure all the mucus, and every time before, after, before, during, after, we make sure to ask the patient to cough, to make sure it's working, is anything coming out, you know. So when you do the manually, you use your hand like carpet, like this, and you put your wrist, and then you start working like this, you know. That's the manually, and you can't go with your palm like that flat. It has to be like this, so this way it can give you know, uh, um, vibration in the lungs, in the lobes. So this way the mucus is gonna be loosened up. Um, Also, we have beside manually, we have the a cappella, or we can ask the patient. I mean, we can give the patient the IS, the incentive spirometer. The difference between both is the a cappella. The advantage about a cappella and the incentive spirometer, because the patient doesn't need anybody to do for them. They can do as long as you train them how to do it. The a cappella, we set up, you know, the bottom has numbers, and we set up according to the patient, and we tell the patients to blow out every time they're gonna use it, and usually we ask them to do every hour 10 times. All right, so they're gonna make sure they're gonna put in the mouth ceiling, and they're gonna blow out. And that works for the walls, the chest walls, because it's gonna give vibration, and this way the patient is able to cough, spit it out, whatever's in there. And I don't have anything to show about the incentive spirometer, but it's, you know, it's a big, like a bottle, you know, like a chest tube box, and it has a tube, and then they can put in the mouth. But instead of blow out, we ask them to blow in. And the reason we ask you to blow in, because it's not only to blow in, but to make sure they get a resistance. That's the main thing for the a cappella and for the IS, the resistance. So when they blow in, they have to make sure they keep the little ball inside in between, so this way they're working in the secretion, and the secretion works, and will come out. Another equipment we use, this is more like in the hospital, and they really need assistance from the clinician, is the precaution. All right, let's say this is the precaution, and it's connect to a machine. It's connect to a machine, and usually we start from the low frequency, and we start going up. Okay, so it's like this, you know, equipment over here. If we put in the patient's body on the back, whatever where we have to work on, and it gives some vibration, and we can use it for like at least 10 minutes, you know. And it depends on the doctor's order. Sometimes they want only once a day. Sometimes they have they want twice every shift change, you know. So this is usually patients does not have at home. They cannot take it because it's more like in the hospital. It costs a lot of money, and they need assistance to do the therapy. Another equipment they can use it for the to loosen up the secretion is the vest. Is the vest is a little bit like this. So, and the advantage for the vest is because the patient can do on their own. They don't need anybody to help. They put the vest, and they have to do, and they can do laying down, they can do sitting up, you know, and it's really good for patients in ICU with mechanical ventilator, because it helps, because they tend to accumulate a lot of secretions. So, and then we connect the vest to the machine, and we set up according to the doctor's order, and the vest is going to start shaking to the patient's body, start shaking, and that's gonna help, really gonna help. So all the secretions gonna, going down. So that's the, the sequence, goes down, and then when the patient goes to the bathroom, it comes out, or the patient can cough it up and clear up the airways, okay? Because the airways has been clogged with the mucus. So of course it's a lot of advantage, of course, but also a lot of disadvantage, because we cannot do those kind of the CPT in patients who had like a neck injury or a head injury. You can't do that. And also we have to pay attention, make sure patients, post-surgical patients, we have to make sure we don't go in this, the seizures, and the incisions, I'm sorry, in the incisions, because it can hurt the patient, and we have to make sure patients who has a heart monitor, make sure we have to remove or not going in tap, because we can hurt the patients. IV lines is another thing the therapist should be aware about that. Um, I hope it was just a brief explanation about CPT, but I hope it was very clear, and I try to work, with my equipments here. I know it's not, it doesn't look like, the real ones, but at least we can have some idea. And this is the patient, the adult patient, we can, work manually. So everything I explain here is on the patient. Like the vest can be in the patient, and the patient can have the acapella and blow out, or can have the IS, this incentive spirometer, and blow in. So I thank you for the incentive you giving to us to do this kind of videos. I appreciate it, and I hope you like, Professor. Thank you very much.